Hello, and welcome to this week's episode of You Can Sit With Us. I'm Matt, one of your hosts, sitting here with Becky.
Hello.
We have Rainie on the ones and twos.
Hello.
And we have two very special guests joining us in the studio today. One is a longtime audience favorite, David Dang.
Hello, this.
And also a very special guest, Dr. Rome.
Hey, thanks for having me.
Welcome, Dr. Rome.
Dr. Rome.
Thank you.
Thanks so much for coming. And for those who don't know, Dr. Rome works at Barber Surgeons Guild, and he is the magician that brought Zach's hairline back to life.
Gosh,
a couple years ago.
And he's thrived now.
And a video is out right now where I also got a hairline refresher by Dr. Rome. So check it out.
Secrets out.
The secrets out.
Secrets out.
But we wanted to have Dr. Rome on the podcast because we have a lot of hair questions.
Yeah.
There's a lot of things happening with hair.
Yeah, thank you so much for having me.
Yes. And actually, I have a question that I've never asked before, but how did you and David meet? How do you know David?
Do you remember?
Do you remember?
Well, do you remember? It's been so long.
Yeah, I mean, we met through BSG, through Barber Surgeons Guild. Yeah, in West Hollywood shortly after we opened.
Yes, it was a very weird connection. Yeah.
Yeah, and then we just became great friends, immediately. So
like very simpatico, but also at the same time. So prior to meeting Dr. Rome, my roommate would always invite me to Thanksgiving with his family. And that year he couldn't go. And I was like, I'm not going to go with your family. He's like, no, just go represent us. I'm like, oh, I've never done that. So I went to
he did the same thing for me for Christmas one year. So it's fine.
That's true.
Interim family.
So I went to represent my roommate at his family's gathering. And I happened to meet one of your team members there.
Mm-hmm. Yeah.
And we just started chatting about what he did, what I did. And it was very, I guess you'd say culminating and attracting. And then he said, you should meet the doctor behind all this. And I said, okay, sure. And then literally that's how it all like played out. And I think we've known each other for 12 years. Wow. It had to be over 10 or
it's got to be about
10. I know that.
Because
how long has BSG been there?
We opened in 2017.
Yeah, almost. Yeah. And I knew you a little bit before that, I believe.
Yep.
But he is the man and the magician, just so you know.
The man and the magician.
Behind all of West Hollywood's hairlines.
Yes. And how did you get into hair restoration? Like what drew you to it?
Yeah, I kind of stumbled upon it actually. So my training's in facial plastic surgery.
Oh, wow.
And in my fellowship, we just did a lot of hair transplants. So I just got exposed to it. The technology was changing a lot, and I just saw like an opportunity to sort of differentiate and do some of these modern techniques that were sort of on the forefront of the scene. Yeah, and just got known for it. So I started private practice. I operated that for a few years and then raised some money with investors and then folded that into what became Barber Surgeons Guild. Yeah.
That's
that is
awesome.
crazy. You didn't know the business side of that before, right? Or did you? Like just in the medical world, like the business aspects of it.
Oh, no, just kind of learned it on the fly.
Yeah. Because that's something that a lot of people just don't do out of the ordinary, especially with hair restoration, It's just like, let me open my own practice.
Right.
Yeah. So you become renowned, which is amazing.
Well, I also wanted to create something that wasn't just me. I wanted to create like a brand, something that could speak for itself and hold its own position. And have its own ethos and values. And that's what Barber Surgeons Guild became, so it wasn't just like Dr. Rome's office.
Yeah.
Well, it is a cool spot. Like even just the aesthetics and everything of it, it's not like a typical medical office feel. You feel like more at home. It's more cool. It's like a vibe. You can hang out.
Not as sterile.
Get everything done.
Yeah,
exactly.
The correct word, sterile.
For those that don't know, barber surgeons were both barbers and surgeons. So for about 500, 600 years, it was one trade. So there was no barbers or surgeons. They were just
Feels
barber
scary.
surgeons. Yeah. They had
So
all
I'd be
the,
like David Dang doing brain surgery on me. I don't know if I would.
Don't I do that?
I don't know if I could do that. I don't know if I trust that. Okay.
But they had all the sharp instruments. So if you think about it, they were doing shaves, they would do amputations. Modern surgery was described by barber surgeons. So, we don't have barbers doing surgery or surgeons doing barbering, but we do bring them together under one roof to kind of address, all issues hair related and using the best technology and style to achieve goals.
And for those who don't know, what is hair restoration?
That's a great question, actually, because depending who you're going to ask, you'll get different answers. Ultimately, in my opinion, hair restoration is a surgical thing. It's like, restoring hair, which is kind of a misnomer actually, because you're not really restoring hair. We're taking hair from an area and adding it to another area. So we're adding density at the cost of, losing some density elsewhere. Right. But there's so much density in the back of the head that you can get away with that. And, even a few times in the course of your life. But in the broader scope, people consider hair restoration, just anything that you can do to prevent hair loss or thicken up your hair. So then there's like sort of like non-surgical things, things like injections and things like medications and other things outside of the scope of surgery.
Yeah, because it's evolved, right? Because I feel like now with Korean technology that's been in traditions for years is now here as part of that hair restoration journey and things like that.
Yeah, and it's actually quite a big picture. So there's everything from just like things that you can do on your own to things that you can come in and have services done all the way to surgical stuff, right? And then even like how you style your hair, right? Like the way that a haircut is done, like if it's done really well, it can actually make the hair look a lot thicker, right? Depending on if the stylist has that eye to understand how to frame it. And David knows what I'm talking about.
Yeah,
yeah. So there's vitamins, there's supplements, there's just a lot in the mix. And I think where some people kind of have trouble is they kind of like hone in on just one thing when really the big picture is like how do you incorporate all these things,
right?
To find the best solutions for you. And those will change based on who you are, your goals, how advanced the hair loss is, things like that. So it's not one size fits all, really.
Yeah, and I feel like also when you think about hair loss, you always think about like a guy going bald. Like that's not the only type of hair loss there is. I mean, a lot of women lose their hair.
Oh yeah.
There's a lot of like genetic things that make you lose your hair.
Postpartum hair loss.
Postpartum hair loss.
Absolutely.
Buy beautiful hair.
Buy beautiful hair.
Buy beautiful hair. Hello, baby hairs.
So do you see a lot of patients that come in for different things besides just male pattern bald?
Yeah, all the time.
I invited you.
Oh no.
Yeah, so
Do you see more than fellas?
male pattern baldness, or just pattern baldness, they call it, because women can also have pattern baldness.
Yeah, not discriminatory.
So pattern
And do they have the
baldness, they call it.
same like pattern as?
It's different pattern actually.
Oh.
So actually,
Female
so male pattern baldness affects more men. Female pattern baldness affects more female, right? Which is not surprising. However, some men can have female pattern baldness and some, women can have male pattern baldness. It's just more common in that sex, right? So typical male pattern baldness is when, you start seeing the hairline recession, right? Those wedges that start going back, or the crown thinning. The crown's the back part of the head, right? For women, it tends to be more diffuse in general and more midline down the part line and temples. Okay. But both of them, we call them pattern baldness or pattern thinning. And that's by far the most common type of hair loss in both men and women. There are other types of hair loss. Some of these more like exotic types of hair loss tend to be more common in women than men.
What the heck?
Well, women,
Targeted.
You're already giving so much.
Women are more prone to autoimmune conditions in general, and a lot of them are related to that. There's sort of like comorbidities often with other autoimmune conditions, right? But yeah, absolutely by far pattern thinning both in men and women. I actually wrote down some stats because I always forget these exact numbers, but
Lay it on us. We love numbers.
Yeah, 2/3 of men experience hair loss by 35. So yeah, it's
Still
so
stands.
common. 25% of men see first signs of hair loss before the age of 21. Yeah.
That's young, yeah.
Has that number decreased, by the way? It's decreased, right? Because before I feel like it was like a little bit higher.
Yeah, I'm not sure.
Yeah.
I don't have it written down. It's possible.
Stop calling me out, David.
2/3 of men have had significant hair loss by the age of 60. And then for women, 1/3 of women experience hair loss in their 20s.
Oh, that makes
So
sense.
yeah, people think of it as like older women typically, but yeah, no, it's really anybody.
It's like everyone. I feel like everyone is losing hair.
Yeah, 40% of women have noticeable hair loss by 50, and 2/3 of women experience hair loss by menopause. So
That
yeah, I
is
mean,
very
we're talking
crazy.
about the majority of human beings here, not not a minority.
Yeah.
Yeah, super
And
common.
I just don't think, well, now because of social media, I feel a lot more conversation is coming out about it because as a hairstylist from that perspective, you know, you see it from the medical perspective. As a hairstylist, when they sit in my chair, I definitely see it right away. Like I call it whenever, I've said this before, whenever I see women thinning or have those pattern baldness issues, is that they look like baby heads. You know how baby have like very
Like finer
thin-
hair.
Yeah, finer hair.
Baby
You could
heads.
see, like you could see the scalp.
That's the medical term, actually. Baby head.
Baby
Yeah,
head.
baby head, right? It is. Look it up.
Baby head.
Look at that little baby head.
Yeah, like they bald like babies, and then men, it's like almost like areata in a way. But that's what I see more often as a hairstylist.
Well, it's interesting you know that because the actual process of hair loss, pattern hair loss in both men and women is what's called miniaturization. So the hairs, they start as thicker hairs and then they become finer hairs. So it's not really a shedding process.
Right.
It's a lack of growing process. So the hairs become finer to, you know, to your point of baby hairs, which is how they basically start when you're a baby, right?
I
Those
hear
fine little hairs.
all the time where they're like, when I was younger, it was this, and now I'm just, and that's when I hear it, I'm like, oh man, okay, let's look at this really quickly. Let's dive deeper. Yeah.
Yeah. So a lot of our therapies are targeted at making those fine hairs into thick hairs.
Absolutely.
What are some of the therapies?
Yeah. So the best analogy I have for people is like there's things that you do on your own, and that's like, you know, brushing your teeth, for instance, right? And then there's things that you can go to the dentist for, like a teeth cleaning. So yeah, the things you do on your own are like the medications. There's topicals, there's pills, you know, there's like supplements, vitamins. We can get into the details of all these things.
Yeah.
And then, you know, then the part where you come into the office for like the teeth cleaning, something like that would be like, you know, stem cells, exosomes, PRP injections, scalp treatments. Yeah. So,
That's like really hot right now.
Scalp, the head spas.
Yeah.
Head spas.
Head
Yeah.
spa,
Oh, yeah.
exosomes, things like that. I mean, I feel people forget that when you go to your facialist, the stuff that they're using on there most likely could be used on your scalp because it's all part of the same like dermis. Yeah.
Same type of skin.
Yeah. That's why you see trends right now, which maybe you can debunk down the road for us. But like people are using retinol like in their scalps more often to help like.
Yeah, we actually use the tretinoin similar in our products.
Whoa.
Yeah. People are.
Who knew? I just do my trat
Yeah, just do it right
up
now.
the front.
those areas
We use
of
a
concern.
lower concentration
Not
than
as
what you use in the
high.
face because we don't want the exfoliation.
Correct.
But we do want the increased penetration that you can get from the other ingredients that the tretinoin can provide. Yeah.
Wow.
Yeah.
Strap for your face, strap for your hair.
I mean,
Trat it
no.
everywhere. Trat everywhere.
You need it all. You need everything. What are some other types of hair loss that people come to you for? So like we kind of talked about pregnancy, postpartum.
It's the after
hormone.
pregnancy, Matt. Pregnancy is great. You're shiny. You're luscious.
Yes, that's true.
Then that
pregnancy
baby
glow.
comes out,
Yeah.
and so does the hair, and it never stops.
Takes it with you.
It takes it with you.
Yeah.
It takes
But
a
you
lot
have a
from you.
beautiful baby now, so it's okay.
The baby needs
Worth
the
it,
hair,
right?
Yeah.
Right? Yeah. Or like hormone therapies. Like
Yeah.
People who are on hormone therapy.
Absolutely. So, you know, the people on hormone therapies, either on androgens or anti-androgens, depending on, you know, what you're taking them for, or postpartum when hormones change. Hormones play a big role in pattern hair loss, both for men and women. And it's actually the underlying changes with your hormones that cause the hair loss in general, right? So, yes, all super common stuff for both men and women. Hormone related stuff. Yeah.
Those hormones, they're everywhere, man. Everywhere.
Yeah. This show is sponsored by BetterHelp. It's easy to realize how a gym membership can be worth the investment, but what about therapy? The state of your mind is just as important as your physical health. Let's talk numbers. Traditional in-person therapy can cost anywhere from $100 to $250 per session, which adds up fast. But with BetterHelp Online Therapy, you can save an average of up to 50% per session. With BetterHelp, you pay a flat fee for weekly sessions, saving you big on costs and on time. Your mental health is worth it, and now it's within reach. At You Can Sit With Us, we love therapy. It's always great to get an unbiased perspective and have someone to discuss your thoughts with. With over 30,000 therapists, BetterHelp is the world's largest online therapy platform, having served over 5 million people globally. It's convenient too. You can join a session with the click of a button, helping you fit therapy into your busy life. Your well-being is worth it. Visit betterhelp.com/sitwithus to get 10% off your first month. That's BetterHelp, HELP.com/sitwithus. And then are the treatments different for people who have hormone-related hair issues, or that's everyone?
Well, when we're talking about pattern hair loss, so male pattern, female pattern, it's all hormonal. You know, so just to get a little nerdy here, what happens is testosterone, which both men and women make. We think of testosterone as like the male hormone, but it's important for women as well. And what happens is the testosterone is then broken down into various active metabolites, one of them being DHT. And that's what's hurting the hair, like both for men and women. Root. Yeah. So it's not a mystery. We know exactly what it is. So, you know, the therapies that target DHT, they block DHT. They of course help with the hair. It helps get it thicker. The other therapies, like they help with the blood flow. So the hairs are very active. Like you can imagine they need a lot of oxygen and nutrients in order to grow thick hairs. So, you know, one way is stop the process of that hormone that's hurting the hairs, or you just increase the faucet and you just flood it with more nutrients, right? So, you know, all of our therapies really target, you know, one of these two pathways in general.
Like, for example, like Becky, are you... Yeah,
what are we?
No,
I haven't done anything to my. Hello.
This is an intervention for you, Becky.
Hello.
I mean, because most of the listeners, you know, like have either they're pregnant, have gone through it, know someone, or things like that. Are you currently going through shedding of the hair right now?
No, not anymore. Now I'm starting to grow back. Okay. But right after, you lose like big clumps. Or I lost big clumps.
That's super common.
Yeah.
And
now it came back gray, baby.
What would you do in this situation? Like gray.
Gray, baby.
Your natural highlights, you mean?
Yeah.
So what would you do in this situation? Like for women who are losing their hair during pregnancy, post-pregnancy?
You're sort of limited for a period of time until breastfeeding's done. Yeah. Right. Because the risk is probably pretty low, but we don't really know the risk of some of these things. So we just say avoid everything.
I feel like that's how it is with all pregnancy stuff. They're like, well, we can't really test it on babies.
So it's not really worth trying. Even though, you know, the ingredients that we use, especially in the topicals, they've done blood tests and see if it affects, you know, blood levels, and it doesn't, you know, so it's probably safe, but we still don't recommend using anything, you know, that we're not like absolutely sure about. Right. But, you know, once you're done breastfeeding, you know, then you can certainly start using the medications, both the topical pills, and they'll really help bring that hair back faster. But also you can do things like PRP. You know, where we draw the blood and inject the growth factors into the scalp. That helps.
A vampire facial for the scalp. You know, but I as a hairstylist get that all the time. So I've been fortunate enough to go through the process with my clients and my guests who, you know, were not pregnant, became pregnant, or planned for it, and then post, and they're going through all of the same emotions physically and mentally that you had gone through, and they're always looking for something. So I'm seeing rosemary trends now, like, oh, just rosemary oil, but I'm like, oil on the scalp. Like, to me, that's like so much, because it's such a huge molecule, you know, like really suffocating, things like that on a science level for me. And I'm like, oh wow, then red light therapy, and they're doing all of these things, and I'm like, okay, let's see what really, really works for you. And again, bodies work very different, right? No one's the same, but it's always something that my guests are always asking for.
Well, there's always fads too, right? So there's things that are trending, and and
quick
these
fixes,
things, a lot of snake oil. There are things with benefits, but then there's a lot of over promising of things. So it's good to kind of like know what's out there and, how different things
debunk. You got to
debunk it. Well,
that's it.
Hair plugs, is that different?
Oh my God. So
I feel like that's like an old 80s, 90s.
You're getting plugs.
You getting hair plugs?
So no one does plugs anymore.
Okay.
I'll just set the record
What's the difference
straight.
between plugs?
Yeah, what's the
and
difference?
what's not?
Okay,
guys, back in the
set the record straight.
So
break it down.
Old hair restoration before my time. Okay, they would do these large plugs, which is basically they would harvest these punches that are maybe like 5-6 millimeters in diameter, which is quite large, and then take them and move these essentially plugs to the front. We've all seen pictures of it.
Yeah,
it looks completely unnatural.
Of your hair, like they take out your hair and they just plug it back in?
So no matter what in hair transplant, we're taking out hair and we're from an area of thickness in the back, and we're putting it to the
Have you ever heard of that, Rainie? This is actually a really good temp check.
No, I'm like, okay, I'm trying to catch up, but I'm also like, wait, this is so interesting.
Rainie, Google a picture of hair plugs just so you can
Have
see
you
the
never
trauma.
heard of hair plugs until today, right?
I've heard like
a
vaguely,
plug.
like I
Okay.
I know they exist.
Probably heard of a
See.
joke on a sitcom.
So the plugs take multiple hair follicles.
So yeah, exactly. So it would be like a larger grouping, just like a section of tissue essentially, right? Like in a circle, and then just plugging that in, and it looks like doll hair.
Yes.
It does not look natural.
That is actually the best imagery. And whenever anybody sits down and goes like hair plugs, I'm like, picture a doll. Like it's so spaced out. Like that's what.
Also, it's like I always wondered when people saw before and after photos of that, and they're like, "Yeah, sign me up. Like I want that." But the way we do it now is very different. So right now we're isolating individual follicular units, which are basically one or a couple hairs that all share one hair pore, one muscle, and one sebaceous gland, and that becomes one unit. Right. So we're going to the smallest anatomical unit of how hair grows, and we're taking those out one at a time and repositioning them. So between actually the plugs and what we do now, there was another procedure called the strip procedure where they would, remove a section of the scalp, the smiley face. Yeah. So a big scar in the back of your head. We don't do those. They are still done, but it's not nearly as common anymore as the way we do procedures today.
You guys. Oh wow.
Yeah.
That was the first procedure where you could have really natural results, but it came at the expense of a big scar in the back of your head, long-term pain potentially, right? Potential numbness too in the back of your head. And
you don't grow hair. And if you have
what are the
keloids? It's like keloiding back there.
So what are the signs of a bad modern transplant?
Oh,
like
that's
people
a
go to
good
like Turkey,
question.
right? They're like, oh, everyone's going to Turkey, get the cheap hair transplants and come back.
Yep. Okay. We can have a whole conversation about Turkey.
Strip it, doc.
Oh my God. But I'll just start quickly with the first question, which is what makes a good versus bad transplant. And I think the most important part of a transplant is this the beginning when you're actually making the plan. So before you even get into it, is this an appropriate plan? Because if it's not an appropriate plan, it's going to be a bad result no matter what, right? So what makes a plan appropriate is, is it going to be natural looking? Is it too aggressively low? Everybody wants a perfect hairline. Well, you know what? When you get older, you're not going to naturally have a perfectly hairline. So we want to make it age appropriate for the future, not just for the present, because when we restore a hairline, it's permanent. Okay. So the hairs that we take from the back of the head, if you see guys, they lose all their hair, but they still hold that horseshoe in the back, that's permanent hair. It will never thin. And when we reposition it, it maintains its permanence. So, we want
your forever hair.
Your forever hair. So we want to set up a hairline. The average age of our patients we treat, surgically speaking, is around like 30 years old, 32 years old. That's yeah. So
that's me at 30.
So obviously we have a range, some younger and older, but it's but we want to make it look good for the 32-year-old, but also as they get older, we want to make it, appropriate. So, not like perfectly straight across, we want to have a slight degree of natural recession. Yeah. The other thing is, we do our best to educate patients on how they could prevent more hair loss, but inevitably, you expect some degree of hair loss to continue. And if you go too low, you're depleting, the donor supply significantly by just filling in. It's nice to, maintain some reserves. So like, should you lose more hair in another area, maybe down the line, you can kind of like have that banked for the future. So it's kind of, you have to think a few steps ahead. unfortunately, with turkey, they sort of have this one size fits all, where it's like this really low hairline, perfectly straight across. They don't have what we call these micro deviations that make a natural hairline, or the satellite hairs. It just seems to be like just a straight row, which is not natural.
You can tell.
It almost looks like
definitely tell.
bad hair system, which is what we call toupees now. But we got rebranded. But yeah, so I diverge. But yeah, and then the I've seen some, where the hairlines are lopsided, where the temples like long on one side, short on other. And, maybe it's a little biased, my what I see, because people that come to me are ones that like just got back from Turkey, want them fixed. I don't see the patients. I'm sure patients do get good results.
Can you fix?
Yeah.
Can you fix?
Yes and no,
I feel like, how do you take it out?
Often it's no, because
too.
Well, exactly. Well, often they Turkey's kind of known for depleting the whole donor supply in one go. So, we don't really have more to work with, right? So that's one problem. The other thing is, if they make it too low, I can't make it higher. Yeah. So you have to almost like get some laser hair removal, and then I can reconstruct it. We've had to do that.
Forehead. That's crazy.
This is the question that I have, because I don't understand, and I totally get it when it comes to budget. We got to be budget conscious and friendly, and it's a very attractive package that Turkey produces, right?
Yeah,
because it's like hotel and everything on social media. Talks about that, right? But at the end of the day, they can't go back to Turkey to go like, oh, I have a problem, or
there's no accountability.
I'm passing at the scalp. Like, what's that mean? Yeah, and they can't go back, right? Or they can, but it just becomes more expensive. So I've heard Dr. Rome talk about these offline, like about him fixing, and it is the word fixing, like these like crazy stories
messed
of
up
people.
jobs.
Yeah, it's kind of wild. So it's kind of like, yes, it's a great package, but at the same time, there's no hand holding through it at all. It's like you're in and you're out. It's a manufactured line.
And there's no long-term outlook, right? Like the hair restoration is one step of a long process. And it's not always the answer too. Yeah. So often people come to us and they want hair transplant, and we say, you know what, that's not for you quite yet. You're actually, we can, resolve your concerns without that. And if we could ever resolve concerns without going to transplant's sort of like the last resort.
Yeah,
it
should be.
Yeah, right. And unfortunately, when you get into sort of like medical tourism focused on surgical interventions, that is what they are going to recommend for you, and it may not be in your best interest.
Such a great point.
Do you see, because I've heard rumors of like Harry Styles or Travis Kelce, like when you see celebrities, are you like clocked? Like, I know exactly.
I mean, sometimes you could tell, but especially that's because like, what they looked like before, right?
Before pictures.
But what I can tell you, because obviously I can't name names, but everybody seems to be getting hair transplants. It's so common. It's so common.
Yeah.
It's a little bit more accepted too. And so when I always see, I don't know if you pay attention, Rainie, when people just go off the grid.
Oh yeah.
Like, you're like, where are they?
And then they come back, and it's like,
all of a sudden, someone comes out, and you're like, wow, that's a full hairline.
But it's crazy how much you actually plan out the procedure. Because I remember you were like, during mine, you were like planning out the way that each hair would like lay and like go in. So you don't just put the hair follicle
artistry
just like in straight down in like perpendicular. You like have to like do it so it'll lay with your actual hair, like how your hair
and
lays.
that's another thing that like when a hair transplant's not done right, the hairs are in the wrong direction, or especially with like temple restoration along the sides here. If those are not like sitting real flat, then they start coming out and they look very unnatural. I have Same thing when we do eyebrow transplants. They have to be very flat. Very flat.
I have clients that went to Turkey, and their like frontal hairline is just basically like pinged out.
Yeah.
It's like,
and some people that works with if you have that, but most people won't.
Like a calic or something, but you don't have a calic, and why is that happening?
Wait, so you said eyebrow transplants?
Yeah.
So is that something that people are doing?
Eyebrow transplants, beard transplants. Anywhere you want hair, we can put it. I've always wanted to do a unibrow transplant, but nobody's asked for it yet. So if anybody out there wants one, please let me know. I'm dying to do one.
Oh my God. You'll be getting the flood of calls.
Do you take the hair from the same donor spot?
Yes.
For beard and for eyebrow?
Yeah. So when we're doing beard
hair is like different.
We can sort of reconstruct the anatomy under the microscope and take the follicles and make them a little bit smaller. It's not going to be perfect, but you can get pretty close.
Wow.
That's crazy.
But yeah, eyebrows are not as popular as they used to be because microblading has gotten so good over the years.
Yeah.
But sometimes like a combination of the two tends to work quite well. So if they someone has like very, very fine, very few eyebrows, and this is for both men and women, by the way.
Yeah.
Then if you do just microblading, it doesn't you don't get the fullness,
right?
But especially if you look up close. So you know what we do in those cases is the transplant first, let that grow in, and then microblade over it.
Mm-hmm.
You know,
makes sense. Yeah, to make it look natural.
And then beard. Generally for beards, what we're doing is more just like patchy fill-ins. Mm-hmm. So a lot of times people can't, I don't know how to describe this area on a podcast. The jowl,
under jowl.
Side of the cheek is a common area. So it's kind of like, patchy areas or transitioning men that can't fully grow in a beard and want to add a little bit more density. That's another common time we do transplants for face.
I got a question.
Wow. Yeah.
What's the deal with just all the hair on the head falling off? Why can't the rest of our hair fall off? You know what I mean? Like with the hormones, why isn't
in the right place?
Yeah, I'm like, well, I lost a lot of hair after pregnancy,
body hair gone.
But not on my legs.
You can submit a ticket. We don't know.
Okay.
We're just made this way.
Yeah, it's crazy.
There's weird theories about it. But
you see the bald men that are just like full chest hair.
Yeah, it is.
And you're
very
like,
wild.
What's happening here?
Yeah.
That makes sense.
Okay.
Crazy.
All right.
Yeah. David, how do you have that conversation with people when you see their hair is thinning and you're like, you should start starting an intervention? Like, what do you say to them? Because
I would literally start crying.
I feel like some people might not take it well.
Oh, that's
what I mean?
I literally was just thinking that question. So about that. So when someone sits in my chair initially, I always pretty much like 90% of the time I do a consultation. Mm-hmm. And it doesn't look the same for everybody. What I do is like I run my hands through their hair because touch is a very important part of that. We've all been in a stylist chair, a barber chair. So you're touching the hair, but then I'm looking at the same time and talking. Like, what are we achieving? Like, what's our hair color look like? And as I'm doing that, I'm doing my scalp analysis. So I'm looking at, is their hair, first and foremost, are there areas of concern? Like, for example, there was a client in my chair this last week, and she only had one part of her hair right here that had like maybe an inch of growth. And it was like a square. And I was like, was she in a fight that she someone pulled her hair out, right?
Trichotillomania.
Yeah, it could have been that. So then after the consultation, I felt more comfortable in asking like, can I ask you a question? And please don't take offense to this, but I obviously have looked at your scalp. Like, is this area because you had alopecia or were you in a fight? Like making it funny, whatnot, depending upon the person. And she's like, actually, I've had alopecia twice.
Oh, wow.
And this is like 3 years of growth and it's only gotten that much.
Oh my God.
Alopecia areata?
Yeah. Just right there. She's like, just only right there. And then I'll proceed to ask like, oh, do you remember that specific time where you stressed about something? Were you like overworked or like, and she was like, yeah, I actually was. And so I said, is that what the doctor has told you? That's when I start asking those questions. Mm-hmm. So that's me. But I definitely feel comfortable in asking people about scalp, like in general. Mm-hmm. Or if there's a client who just came back and I can see, I always ask like, oh, have you started experiencing hair loss in the post-pregnancy stage yet? Not yet. Hopefully I don't. I'm like, okay, well, let's, see, are you breastfeeding or are you not? And then from there, I will refer always. But let's go back a little bit. It's crazy because for Zach, let's talk about Zach because everybody knows Zach, right? Because I do love this story. And if you've never heard it, it's a really good one. When Zach first came to me, obviously we all know how that happened. And he started getting his haircuts with me. He was like, I started asking him like, do you notice that you're losing hair? And he was like, yeah, I've noticed, but I don't think I have to do anything about that yet. Then I said, can I see some pictures of you in college? Right. And then he showed me a picture of him in college. I'm like, oh my God, you were losing your hair then and you didn't even know. And that really opened his eyes. But he was too scared to get surgery. It took us 3 years to get surgery. So what I do is I call it the hair scalp boot camp. And so I'll start to say, okay, let's start doing biotin gummies, right? If your
baby
doctor,
steps.
baby steps. It's almost like the boot camp, right? The journey. So once he starts taking the medication or like the gummy, that's going to be post-op anyways. He's going to have to take that, right?
Yep.
So he's already doing it. Then I'm talking about, okay, let's do a mask on your scalp. You do that once a week, or like, here's what you're going to do. Remember to rake this across. Like, and so he's already doing this. And by the time the surgery happened, he already knew what he needed to do after. So that makes him feel more comfortable because I can see, because I have a trained eye, I can see the path. But after like month 6, month 8 year mark, I will tell them, I think it's, if we don't see improvement, then we need to probably go on to the next phase, right? And I'll take pictures of them on their own cameras. I won't do it on mine. I'll take pictures of them, and then we'll take one every time they come back, and then they'll see for themselves, oh my God, I am losing my hairline.
It's hard to see if you're looking at yourself every day. You know what I mean? You don't notice, like,
to Dr. Rome's point, like, nobody recognizes until it's too late. What is the percentage? Like, when they recognize that they want to do something, it's 70% gone.
So it takes about half or 50% of the hairs to be lost before you can appreciate visible thinning in a given area. So you can lose say 10, 20, 30% and not really notice it. Maybe it starts feeling a little thinner, but you're not seeing scalp. You're only seeing scalp at about 50%. Which is why, by the way, we can thin the back of the head out a little bit without it looking too thin. So say you take 10, 20% back there, it's not going to look thin. Right, that's how this works. But something you said just made me think too, David, is that people tend to be very reactive and less proactive when it comes to treating their hair. So they'll say, "Oh, it doesn't bother me yet. I'll react when it's time for me to react." But often your choices are more limited when you're reacting, right?
There's nothing.
So we actually do start seeing more lately, like younger men and women that are experiencing hair loss at the very beginning. They see their genetics, they know where things are heading. The discussions,
that was me.
The discussions what a lovely transition. Dr. Rome, you teed that up so perfectly. We're talking about Zach, who was obviously, like, you could look at the guy before. Not a lot of hair. So like his hair restoration journey, you're like,
the drag.
We get it. We understand.
Yeah.
Matthew, Mr. Italian, full of hair.
Yeah.
Got a hair restoration with you.
A hairline refresher, I call it.
A hairline refresher. What's the deal?
Yeah, actually, do you want to explain the deal? I'll get.
I feel like I fell into the camp of the people you were just talking about.
Yeah.
Like everyone's like, oh, you're not, like, when I told friends I was going to do this, they're like, why? I saw it in my head, like, I saw the genetics, saw my family tree, I see what happens to men in my family. And then also I looked at it more like Botox, you're like preventing the wrinkles from happening by getting Botox. So I was like, okay, if I get this now, give this hairline fresher now, it's kind of preventing me from looking more bald later on. And, try to take better care of my hair now so that I'll still have it later.
Yeah. Yeah. And folks like you are like our most common type of hair transplant. People think of hair transplant as, when you have to have a lot of hair loss. And,
visibly.
That was more like back in the day, when the thresholds used to be much higher to do transplant because the surgeries were much more invasive, or they weren't as natural, more downtime. And now we can get very like fine-tuned granular with these individual hairs that people are doing it younger, and for less hair loss. So, what the hairline refresher, as you put it, is quite common. Just reinforcing the hairline. For you, we didn't really lower the hairline particularly. We just added density to it, and maybe a little bit lower, and added more strength around the border and the wedges, around the corners. But really, and then the long-term maintenance, focusing on things to prevent future hair loss.
Right.
That's crucial.
So what are some of those items? What should I be doing now that I've had the procedure? What's next?
Yeah, absolutely. So long-term maintenance with medications, topicals, pills, both ideally.
So the topicals are like minoxidil.
Minoxidil.
Yeah. So let's get into each one, I guess. So on the pill side, there's things with DHT blockers and like minoxidil, which increases blood flow. So we use minoxidil at low dose. Actually, for women, we use it at a very, very low dose.
Yeah.
So about the quarter of the dose we use for men, because one of the side effects of minoxidil can be increased body hair. Okay. And women tend to not appreciate that as much as men.
so much.
But again, at the low doses we use, it's very uncommon, both for men and women. It tends to focus more on the hairs that are more actively growing, which are the hairs on your head.
Interesting. Okay.
Yeah. And then and then the DHT blockers. So either finasteride or dutasteride. For women, actually, we only use dutasteride. Studies show it's more effective with women. But for men, we have the option of both. When we use finasteride, we actually use a very low dose. So finasteride is the active ingredient in Propecia, which everybody's heard of. Propecia's been around for a while, but we use a fifth of about a quarter of the dose actually a fifth of the dose, of Propecia. So 0.2 milligrams instead of 1 milligram.
Is small. Yeah, because I've been on finasteride for like, I don't know, over 10 years.
Yeah. So you took the action right away, which is great.
He saw it.
Yeah.
He saw it in his DNA. So.
Oh my God, poor Steve is listening to this podcast. Matt's dad is like, what do you mean you saw it in the genetics?
Of it
Yeah,
all.
absolutely.
No, but that's what I recommend as a hairstylist too, is like minoxidil.
Yeah.
So I recommend that right away if I see that that is going to happen. You know, I obviously do a low blow. I don't go like, boo, it's gone in about a year. No, but like to the boot camp portions of it, the boot camp portions of it, like I really do.
You got to work them up to it. Train them up to it.
And it's like, I always use the terminology like, let's save what we can now.
Absolutely.
Like,
whatever you can save, you don't have to restore, right?
Right, right,
it's
right.
true. And that
Helps in
goes
the
with
long
women
run.
too, right? Because like
100%.
Yeah, with women too. I feel because it depends on your style, but because you have longer hair, like a blunt bob or whatnot, the fullness of it all looks like something, but you're really feeling the thinness before.
Yeah.
Because I also in the consultation here when women are brushing their hair and they're feeling like, a lot more is coming out, but I don't see it, right? Or in the shower, there's just a lot of it. And I always go, okay, well, measure that, right? Like, so like if it's 1 week it's here or 1 month it's here, then the next month it's like, oh, there's a lot more. Then it's like, it's time.
Save it all for your wig.
Now it's
Save it all for
Like
your
a little
wig.
baby doll.
now it's time, right?
Twist it up.
Actually, it's worth noting when you start seeing a lot of shedding, that's not related to pattern loss.
Correct.
So pattern loss, as I mentioned before, is a lack of growing, right? Not a shedding.
Interesting.
Yeah.
So
Okay.
when we have
They're different.
shedding, generally that's like, during stressful times. And it could be for different reasons. It could be because the body's stressed because it's sick, or the body's stressed because there's, mental stress, right? Like all these, anything that's causing cortisol spikes and like just stress in the body can cause shedding. And the good news is shedding tends to be temporary. Okay. And it could be a while though. It could be 6-12 months before the hairs start to really grow back, but it's not typically a permanent thing. Whereas pattern loss, which is the lack of growing, tends to be permanent. Where it gets tricky is people often experience multiple reasons of hair loss at once. So, it's not usually just one thing. So what happens is when people go through periods of stress and start shedding, the underlying pattern loss becomes more visible. It's more transparent. Because remember we said 50% you start seeing it, but maybe you were at 30% and then now you shedded a bunch. Now you're starting to see that pattern loss. So we see that often.
That's so
Happening at the same time.
Yeah.
I feel like that's what happened to me is I noticed so much shedding.
Yeah.
And I was like, oh my God, why am I losing all my hair? And that's when I went to the doctor and was like, what can I do?
Yeah.
And he prescribed me finasteride. But I feel like that's also at a time, like when you're in your 20s, you're working a lot, you're stressed, you're trying to start
That's
your
not on top of your
career.
mind.
So
Yeah.
it's kind of like you're stressed to begin with, but then that's also when the pattern baldness starts to play into
Kind of
that.
Yeah,
settle in.
absolutely.
Right?
Absolutely.
So it's been like what, 2 months? I want to say month and a half since I had my procedure done. And the hardest part of the whole thing was having to sit still. Before and after. Like doing nothing is actually was the hardest thing.
Yeah.
Because like during the whole process, it was like, I don't know, 6-7 hours where you just started kind of like sitting or laying in a chair the whole time.
That's crazy.
While there are like multiple people are like working on you and stuff.
You don't go under for the
No,
surgery.
No,
It's
you don't
surgery,
need to.
Maybe
baby.
you like
It's
a lot of laughing
outpatient.
gas. So you kind of feel a little under something, under the influence, but you're not like knocked out,
Yeah.
you know? So it kind of helps the experience go by faster.
It's like you're stuck on a long flight somewhere.
Yeah.
Oh
And
my God.
you can get up, move around the cabin. We'll provide, meal
That's such a
service
great-
for you.
Bathroom breaks.
Bathroom
Yeah.
breaks,
Dr.
but
Rome's
you're stuck in a chair
hairlines.
for most of the time.
Yeah.
But even like recovering and stuff, like you know, you can still do like normal activities, but you still can't do
You're limited for a week.
Yeah. So you're like, you still feel like you can't move a lot or like do my normal things that I would be doing every day. So that was the hardest part. Was
But
like
it's a
doing
week.
nothing.
It's not that bad, right?
Yeah.
1 week.
No, it wasn't too bad. It was sitting still. It's like you have to sit still.
Yeah.
You know, and that's just like the hard.
Also,
Can't
the
do that for too
recovery
long.
for those of you who've known Zach's journey was very different from your
Oh my God,
journey.
yes.
Because Zach blew
He had
up.
potato face.
Zach,
Bobby.
Did you
Zach-
swell it all? Did you swell it all?
Bobby.
I actually like no
Just
one
right
could tell
here,
I was
right?
swollen except for me.
Okay.
Right here.
Like Eugene couldn't even tell I was
Yeah.
swollen. It was like my forehead
Yeah.
did get a little swollen, so I just like ice it and stuff. And
Yeah.
that would really help. But when I had my 1 week like follow up appointment, Rodney was like, "You've already healed up so much faster than most people healed up. Like I can't even see like there were no scabs. Like all the scabs had fallen off.
Yeah.
Like it
Well, that
healed
means you
so
took
fast.
good care of it. You followed instructions.
Yeah.
Yeah.
I followed all the instructions.
You really
Like,
did.
almost zero swelling. And the only thing is that it was like itchy. It still is
Oh,
a
yeah.
little itchy,
Yeah.
Mhm.
but it was just like so itchy.
What's the pain level compared to like, well, you don't have one, but you have one, a tattoo.
A tattoo? I mean, I've never had a tattoo. I don't know.
We'll give
That's
our
true.
we'll give our own experience.
it wasn't that
Blend it
painful.
together.
It wasn't
Blend it
that
together.
painful. Yeah.
But are you
Because
like,
like during
a
it, you
high
can't feel
tolerance
pain
person?
because they numb everything.
Yeah, the numbing doesn't feel great, but it takes 30 seconds and then you're numb.
Yeah.
You know, it's not a
So
painful
you
day.
literally don't feel it. You don't feel
Okay.
anything.
Did
I've
you-
had
the whole
multiple,
time.
I have had multiple clients obviously referred to Dr. Rome, but also multiple clients who've done it other places, and they're like, it's not that bad. It really isn't. On a scale, if you're really thinking about it, 3.
And there's
Yeah.
really not much pain after.
No,
too,
there isn't.
Right? Like you think of with all this like trauma, the micro trauma, that there would be a lot of pain the next day, but there's typically not. Sometimes after a week or two, the back of the head, what we call the donor area, starts getting a little sensitive as the nerves kind of
I think that's the
start
right
back
word.
online.
It's the sensitivity.
Yeah, and it's a
very
recalibration of the feeling. And sometimes when you recalibrate the feeling, it kind of overdoes it before it like titrates back down to normal.
okay.
It always comes back to normal, but
Yeah.
it can be a little sensitive for a little while.
Because they took 1,500 hairs
Units,
out the
yeah.
back of
And that's
your
not that
head.
many.
So that's 1,500
Oh, that's
holes.
not that many.
Well,
That's
more
like
hairs.
1,500
That was about the grafts.
Yeah.
Yeah, it was like
'cause-
1,500 holes in the
Yeah,
back
holes.
of your head, basically, that are trying to like all seal.
But we're
back
talking
up.
about one little less than 1 millimeter in diameter.
Yeah.
So they heal real nicely.
You have to catch out on the video, folks, like to see what that looks like, because that was some crazy thing.
Yeah, Matt.
Crazy.
Speaking of the video, what was it like filming? You don't normally participate in videos.
Wow.
A sister out.
At least not in a little while.
I participate in a video with you every single week. I don't know what you're talking about.
One where you have to leave and have to be in. I saw pictures from the BTS.
Yeah.
It's not
Yeah.
exactly
We were
the largest
communicating.
room to be in
Yeah.
with camera
Yeah.
equipment.
I mean, it was kind of weird because it was also different than any of the other Try Guy videos I've done because it's like it's like a very vulnerable position to be in, right? Like you're getting a medical procedure done and there's cameras all around you asking you. And like a lot of it is like gross medical stuff. Like they're literally like punching holes in your head or into your scalp, I should say. So it's like they're doing like close-ups of it and they're doing close-ups of like the hair coming out and stuff. So like that, luckily I didn't have to see any of it. But you know, it's would have been more pleasant to not have like 6 people watching you do it, right?
While
It would have been
getting
more
surgery.
relaxing.
Yeah.
It would have been more relaxing.
Yeah.
And
I'm
then
sure.
But
what
it
was it
wasn't
like
that
for
bad.
you being filmed while you're doing it?
It's interesting. Yeah. It's definitely more relaxing also when there's not the camera crew around. But no, everyone was so chill and nice and
Yeah.
friendly. And yeah, it was just a good time.
Yeah.
I think the team was really great too because everybody's just really focused on.
Oh, yeah.
It was a normal thing, but everyone was very focused on making sure that
And everyone was
craft
super
was there.
interested in it too, which I appreciate, you know, because it's like what I do. But
Mhm.
everyone
Yeah, lots
had
of
a
questions.
genuine
Yeah.
interest in it.
Yeah.
You know, no one was bored. It was like exciting. So
Yeah, the whole time. And it was
it was good energy.
actually cool to have Zach there because I would be like, okay, this happened to me. Like, how did you feel at this time? Or he would be like, I remember I couldn't stop hitting the laughing gas the whole time. He's like, you haven't had
course
the
he
laughing gas
would.
in a while. Like, you know, so it was
Course.
like interesting to compare our experiences
Mm-hmm.
at the same time.
And he was also
Yeah.
looking at it while it was going.
Yeah, because
not just from a
he
video
was
perspective.
looking at it from like the outside
IRL.
perspective now.
Yeah.
Instead of it happening to him. Even though at the end of the video, he was like, I could see myself coming back to get another one.
Because he's been contemplating. He's like, I don't know. His hairline refresher. Like
Mhm.
he's been contemplating. So he's like, oh, I don't know if I want to go through that again. But he, because of the blow up after
Yeah.
his
Because of
potato
Bobby.
face. Because the
Bobby
Bobby,
potato.
Bobby
my
potato.
God.
Yeah, most people don't swell like that.
Yeah.
He even in the videos saying that he didn't take the pills, the anti-swelling pills afterwards,
Oy.
and that can happen.
Make a warning sign with him on it.
But no, I was actually glad that people saw that because
because it's real.
It is a real thing,
Mhm.
and also he swelled up so much that I
Right.
know most people don't swell up that much. That everyone's like pleasantly surprised that they don't
Yeah.
swell.
The expectation
Yeah.
is so
Yeah, exactly.
far.
He set the bar.
Yeah.
Really
So-
did.
Mhm.
Really
Yeah,
did.
most people just don't have that
I've had
degree
like
of swelling.
it depends on where you're positioning them too, right? Because then I've had clients who've had like a little bit of bruising around the eyes or something
Yeah.
like that. Again, everybody's so different, you know.
Well, the anti-swelling medications really make a huge difference, but for
Mhm.
some people, like with Zach, it just it can make you feel a little weird, you
Yeah.
know. Like,
Yeah.
and for most people, it's fine; they tolerate the meds. But for some people,
Mhm.
they're really sensitive to them,
Mhm.
and it just throws off their mood. In
Right.
that case, just don't take it. Not a big deal. It's not necessary. Worst is you swell and the swelling goes away.
Right, right.
But,
Worst
On
thing that
its own.
happens is everybody on the internet screenshots it,
Yeah.
makes a name
Yeah,
for
yeah,
it,
yeah.
And you're
Bobby,
there.
Right.
and
Exactly.
you're haunted by it for the rest
No
of your
Bobby
internet
for me.
visit.
Yeah. No Bobby,
Bobby
for
for
me.
No Bobby for me.
Did you notice anything different about, because you essentially were in a video like 5 years apart? Like, was the sort of the production process different between Zach and Matt's?
I felt like it was pretty similar.
Pretty
Yeah.
much. Okay,
It really
fine.
is.
Yeah, that's
Yeah.
good.
That's good.
Got it right the
Yeah.
first time.
Yeah.
I did have a question on, because for Zach, you guys used like the robot machine,
Yeah, yeah.
right? So why did you use the robot machine on him, and then on me it was more manual?
We'll do it. It depends. So we get really, really good results with both.
Mhm.
When we do a window like with yours, it's a smaller area.
I see.
So it's a little bit easier to get in there manually.
Ah.
A window is when we pin the hair up and we shave less of an area. So yeah, I mean, we use both
Mhm.
techniques. Ultimately, most of the procedure is manual anyway.
Right.
So making the recipient sites, putting the hairs in. It's just the way that the hairs are extracted.
The artistry.
How do you, because it's not, you just said shaving, but you don't shave it to then plug, right? Are you plucking? Like, how do you remove the hair?
So actually, if you pluck a hair and you try to put it in, it won't grow because it needs a little tissue around it.
Mhm.
So we
Oh.
actually have to core it out. Okay, I know it sounds
Oh my
gross,
God.
but we're talking about less than a millimeter in diameter and about
Can't
3
wait for you to
to
watch the
5
video.
millimeters
Yeah.
deep.
Oh,
These
wow.
are this
You're like-
micro. Yeah, not really the scoop that you
scoopy?
just did.
No.
That's
Oh
like
my
an
Lord.
ice cream
No
scoop.
scooping.
Like a melon
Yeah,
scooper.
melon scooper. No.
Definitely
very,
no
very fine.
scoopies.
And anyone's had a cut that's worse than what we're doing.
Yeah.
It's just that we're doing thousands of them,
Yeah.
so it takes a while.
Yeah.
But it heals
In a
very
concentrated
fast.
area, too,
In a
essentially.
I
concentrated,
mean,
exactly.
the machine looks like a pen, and it's like
Mhm.
the tip of the pen is actually like a hollow
A
drill.
calligraphy pen.
Yeah.
That goes around the hair follicle.
That doesn't make it better, man. That description
But it's very accurate.
didn't soothe me.
I do have to say though, we did go on a trip after. We went to Tulum, and
Yeah.
the window of opportunity back there was not seen.
Wow.
Yes.
The window of opportunity.
Yeah.
I like that.
Was
Yeah.
not seen back there. And
No, no one could
also-
tell.
I
at
was
all.
on him though, doctor, just like
Yeah.
you know. So I was like, here's a UVA, UVB hat that you need to wear just in case.
Yeah.
And he was on the hat, everything.
Yeah.
It was great. You were
Yeah.
healing very quickly too. Like to what he said, like your skin was very tight. I was like, dang, that is crazy. Yeah, it was. It was kind of bizarre to me because I've
Fast.
never seen it like that.
Mm.
Yeah.
I'm just like so amazing, Becky. Just
But I don't know what vitamins
This
and
feels
things
so
you're
fun.
taking
I've always
there.
said it. I've always said it.
Yeah. No, but Dr. Rome, tell us a little bit about blends. Try blends. Anything else?
Yeah.
Or your package of cryotherapy. and
Sure.
things
So
like that.
yeah, it's direct to consumer. You can buy it online. We're at about 40 states now.
Wow.
Eventually, we'll be everywhere. We have the topicals and the pills, and yeah, just really about finding the right doses for people. And we start lower than a lot of places because less side effect risk. And generally,
That's really
a
good
lot
to know.
of the studies are showing us now that you don't need to really push the dosages too high, and then we can always titrate up. So we can go completely custom. So
That's
we have
amazing.
certain formulations that like these are our ones that we recommend you start with for different reasons that you can
Mhm.
read about on our website. And then
And that's tryblends.com. right?
yeah, TRYBLENDS, Triblends. Yeah. And then you can we can modify them and sort of make custom tweaks to them, you know, and find what's right. Yeah, personalization. Yeah. So instead of having to take, you know, half of this pill, 3/4 of this pill, and then a separate vitamin, like literally everything's all in one. Just makes it super easy and really, really effective for both men and women.
The hairscription.
Yeah.
The hairscription.
That is what you
The
want.
hairscription.
And for also for like trans guys and trans women, like that's you know, people that are just, I feel like the conversation of hair loss is just not really there yet.
Yeah.
You know, when I started, it was like men were starting to talk about it a little bit. Women were not, which is actually opposite of mostly everything, like Botox and everything. Women were much more comfortable. Now we're seeing more women talk about, you know, hair loss, right? But I think that the trans community is really underserved with this, and
Right.
you know, we see you know, a lot of transitioning men and women at Barber Surgeons Guild at BSG, but also with blends. You know, we have something that comes up on the very beginning: choose your sex assigned at birth, which is important for us to know because everything's hormonal, right?
Yeah.
How we make our formulations, but also we have special considerations for those that are transitioning because the hormones that you could be on or the anti-androgens play a big role in our formulation.
Right.
Yeah. And the other thing is a lot of places are very uncomfortable prescribing DHT blockers to women because they do have a potential risk of birth defects. And that's real. And that's something that women need to know.
Right.
But because of that, they're just, you know, not using those medications at all, even though they're so effective. Even with like postmenopausal women where that's not even a risk, right? So for us, it's a no-brainer. Yeah, postmenopausal, please, like this is a great medication to include.
That's
but
really
also
good to know.
premenopausal, we have the disclosures on there, you know, make sure you're using birth control. If you get pregnant, stop using immediately. You know, there's medications prescribed to women all the time that they need to stop when they get pregnant.
That's like Accutane.
Right?
Yeah.
Accutane.
I took one that I
There's-
just stopped
There's
when I
tons
got
of
pregnant.
them,
Yeah,
and this
there's
is just
tons.
another one of them. And I feel like for women, the most effective ingredient is just not out there. As far as I know, we're really the only ones that are using that ingredient.
know.
And when there's tons of clinical studies. So if anyone really wants to nerd out, scroll to the bottom where all the detailed information is on our website, and that's where all the journal articles are cited for all the evidence-based research that we base to use our formulations.
That's
That's
amazing.
awesome.
Yep.
Science.
Science. You gotta love
magic.
science.
It's like magic.
We believe in science.
Yeah, we love it.
Yeah.
But I think too, like anybody who's listening now, which hopefully there's a lot of people that are listening to this episode, is that Dr. Rome, for example, and I'm using him because he's here in the studio with us, is that he does free consultations. Like just ask. Like it's not hard to just ask and then really go to the source and ask for like, here's some pictures. Can you tell me what's up? Or can I make an appointment or things like that? I think when, you know, you're going to Ulta or Sephora things and they're just trying to find these quick fixes, like you're spending so much money on things that are probably not doing a lot for the scalp nutrition and whatnot and the health of it, you know?
Yeah, and so much of what we do is education. So we're not here to give you the answers. We're here to, we are here to give you the answers, but we're not here to make the decisions for you. We're not here to make the decisions for you, you know? So it's like, you know, there's a lot of questions that people have. And even if they don't necessarily know the questions, we've seen so much of this. We know like kind of, here's the information for you to digest and then, you know, make the best decisions based on that.
Well, thank you so much for sitting with us.
Thank you so much, Doctor.
Thank you again for giving us your time. Lots of great information. And we all learned a lot. And where can the people find you, Dr. Rome?
So barbersurgeonsguild.com.
Barbersurgeonsguild.com.
Yeah, that's
Are you on the
The spot
gram?
to
Are you
go.
on the TikTok?
Oh yeah, definitely. Yeah. So at BSG Dispatch is there, and then
BSG Dispatch. Love it. And in the comments, please reach out, ask some hair questions. We're going to have David back on in a few months to respond to them, give his hair description for you, styling, anything about hair. Ask David some questions. So until next time, please remember to pee after sex, be nice to your friends, be nice to your family, and ask questions. Get inquisitive. If you have any questions, especially
into
about
the
your hair
cues.
health, ask an expert. Until next time, bye.
Bye.
thank you.